This is the second lecture of our hematology series lecture. It's about anemias. So we will talk about anemia, and then we will talk about the classification of anemia, their causes, as well as their lab diagnosis. So what is basically anemia? Anemia is defined as decrease in hemoglobin level or total circulating red blood cell for age and sex of a person. What it mean is the hemoglobin vary between different ages. For example, in newborn babies, the hemoglobin level is from 14 milligram per deciliter to 24 milligram per deciliter as compared to adult male in uh, which having hemoglobin from 13.5 to 17.5 milligram per deciliter, and in female the hemoglobin is less as compared to adult male. So in female it's vary from 11.5 to 15.5 milligram per deciliter because of the because of the lack of androgen and menstrual loss of blood. So there is different classification of anemia. The one of anemia, which is called microcytic hypochromic anemia, as the name indicate, the cell will look smaller in size and there will be more paler area. Hypo mean less, chromic mean color. So the hemoglobin, which gave um, reddish appearance to RBC, so this paler area will be increased and the hemoglobin color will be decreased. So it would be hypochromic. Then microcytic anemia, microcytic macrocytic anemia. Macrocytic is basically the cell will look bigger in size in this kind of anemia, and then normocytic normochromic anemia, in which the cell will look normal as well as the hemoglobin inside the cell will also normal, but there will be decrease in the red blood cell, so it lead to normocytic normochromic anemia. And then hemolytic anemia, and when in which the RBC um, lysis occur and it's lead to hemolytic anemia. And there are common symptoms associated with anemia such as fatigue, paler skin, dyspnea, tachycardia, which mean increase in cardiac beating or heart beating will be increased. So the heart rate will remain high, and then dizziness. So before going into anemia, first we will discuss about iron deficiency anemia or microcytic hypochromic anemia, which is a type of anemia. So before going detail, let me talk about the hemoglobin, how hemoglobin take formation take place inside the cell. So transporin which carry iron into the cell in the and transport it to the mitochondria. So transferrin after transporting the iron, transferrin go back out of the cell, and iron go into the mitochondria of the cell. And there are other component which includes glycine, vitamin B6, succinyl CoA. It's after the reaction uh, between all these components result in the formation of aminolevulinic acid, and then parapabilinogen, and ultimately protoporphyrin. So protoporphyrin combined with the iron in the ferrous form, and lead to the formation of heme molecule, and then heme molecule combined with the globin chain and form hemoglobin. So in adult we have the majority, which is 96 to 98% of alpha and beta chain. So alpha 2, beta 2 with 4 heme molecule lead to the formation of hemoglobin. Uh, on the right, you can see the protoporphyrin, which we get from the combination of glycine, B6, and succinyl CoA. All these is required for the formation of protoporphyrin. So in different type of anemia, such as sideroblastic anemia, in which different elements such as lead, interfere with the enzyme responsible for these reaction, and it's inhibit the formation of protoporphyrin. Um, so if there is no protoporphyrin, there will be no heme molecule and will result in decreased hemoglobin level. On the other hand, on the right, you can see if there is decrease in the iron level, for example, in certain inflammation or malignancy, there is a lot of cytokine which is produced in uh, chronic inflammation such as IL-6. So it's inhibit the absorption of iron, and also, interfere with the metabolism of iron, lead to decreased heme formation and ultimately hemoglobin. Um, Another way to inhibit hemoglobin is uh, decreased synthesis of globin chain, either alpha, beta. So the decreased synthesis of the abnormal synthesis of hemoglobin chain lead to the decreased level of hemoglobin, because if there is abnormality in the chain, so the protein will unable to bind with the heme properly, and there will be no hemoglobin or decreased formation of hemoglobin. In normal adult, we have 96 to 98% of HbA, which compose of alpha 2 and beta 2 chain, and then 0.5 to 0.8% of HbF and HbA2, which is made up of alpha 2 and sigma 2, and it's from 1.5 to 3.5, 1.5 to 3.2%. Then there's in this slide I put a lot of now in a lot of values about cells, how what is the lifespan of each cell we have in the peripheral blood, as well as their size. For example, RBC, which size from 6 to 8 micrometer in diameter, and their lifespan is 120 days, as well as their normal range within the blood. Then platelets, which is 0.5 to 3 micrometer in diameter, and lifespan is 10 days, and so on. The other inflammatory and defensive cell I have put over here to understand their function, their normal values, as well as their lifespan in the blood. So, microcytic hypochromic anemia, as we have discussed, in this type of anemia, there will be decrease in the absolute value, which include MCV, mean cell volume, mean cell hemoglobin, and mean cell hemoglobin content below normal range. And this type of anemia is commonly seen in iron deficiency, thalassemia, sideroblastic anemia, and anemia of chronic disorder, as I have shown in my previous slide, how these iron deficiency or sideroblastic anemia, which occur due to the lead poisoning and thalassemia, in which we unable to um, properly synthesize the hemoglobin chain, so there is abnormality in the hemoglobin chain. This kind of anemia we see in these condition. Then macrocytic anemia. In this type of anemia, the RBC size is larger than the normal, and absolute values show increase MCV and normal MCH and MCHC. And this type of anemia commonly seen in megaloblastic anemia and aplastic anemia. Megaloblastic anemia due to deficiency of B12, which is called pernicious anemia also, and folic acid, while aplastic anemia, and when the bone marrow unable to produce blood cells, so it's also lead to the formation of macrocytic cell. So this kind of anemia can be seen in aplastic situation, as well as hemolytic anemia, liver disease, myxedemia. If there is hypothyroidism, it lead to a condition called as myxedema, and then hypopituitarism, pregnancy, and alcoholism. So these are the main causes of macrocytic anemia. Then normocytic normochromic anemia. This type of anemia, the hemoglobin concentration of blood is reduced, but the cell look normal in size, as well as the hemoglobin also normal, any amount. So this type of anemia can be seen in acute blood loss, leukemia, bone marrow infiltration, chronic renal failure, and chronic infection. So these are few causes of normocytic thermochromic anemia. So let's talk about deficiency anemia. What are the causes of iron deficiency anemia? There are multiple causes, but most important of them is chronic blood loss, which usually happening and GIT bleeding or menorrhagia. And GIT bleeding, there are certain causes. One of them is parasitic infection, which is most common in the children. And then increased requirements such as pregnancy and growth. It could also lead to iron deficiency anemia. Then reduce intake, like some people unable to take food which have uh, um, enough iron, so reduce intake or malabsorption such as gastrectomy or due to celiac disease. So low iron impair heme synthesis, microstatic hypochromic RBC in the clinical future include fatigue, weakness, and pallor and scale color. Chylonychia, which is basically the increase in the white area at base of your nail. If you look at your nail, there's a whitish area at the base. So in this kind of anemia, you will see uh, increase in the whitish area at the base of the nail, and this is called chylonychia. And then atrophic glossitis, angular stomatitis, and pica. Pica is basically some kid they eat soil or mud or paper. So paper. So these kind of condition can also lead to iron deficiency anemia. So low RBC, low HB, low MCV, and low MCH. Um, low HB, low mean cell volume, and low mean in hemoglobin. You will see in complete blood picture, and the blood film will show microcytic microcytosis in hypochromia and anisopoikilocytosis. Aniso mean there's a different term which is used, per the reporting of blood film. So aniso mean the abnormality in the size, poikilocytosis abnormality in the shape. So anisopoikilocytosis, in this kind of anemia, you will see abnormality of the shape as well as abnormality of the size. So it will be a kind of dimorphic blood picture. And the iron profile, low ferritin, low serum iron, high TIBC, total iron binding capacity, and low transparent saturation. Then in this slide, I have shown you the normal RBC malpharmacy on the left, while there is, iron deficiency anemia in which you can see the increased pallor area within the RBC. Uh, so it's if you see such kind of picture, so you can advise for you can do further test and investigation to diagnose the cause of the disease. Then megaloblastic anemia. Before going into detail of megaloblastic anemia, let me talk about vitamin B12 and folic acid, which is really important um, per the cell in low formation within the cell. So it's really important to have knowledge about these vitamin. So as you can see, there are kind of cell called as parietal cell which produce a factor called as intrinsic factor, and this factor combined with B12 and protect it from degradation, and it's go and absorb through the receptor within the ileum. So the B12 uh, combined with intrinsic factor and absorb in the ileum, which is the part of small intestine, and then um, folic acid. It's absorbed in the form of methyl tetrahydrofolate and the duodenum and jejunum, and transport into the blood and ultimately into the bone marrow per the cellular activity and nucleus formation. So megaloblastic anemia is there are multiple causes,